Matrenue Percutaneous Balloon Compression PBC Kit is the first PBC kit with manometer developed by SYM Medical. It can achieve accurate puncturing during surgery, precise control of time and pressure. The Matrenue kit contains PBC balloon catheter, manometer, puncture needle kit, and syringes. The manometer is specially configured for PBC surgery to achieve accurate pressure display and control during the surgery, and it is very easy and convenient to use. Under the CT imaging, the doctor can accurately position the foramen ovale where the needle will puncture until its tip reached. The stylet could be stretched into the Meckel's cave to build a smooth and safe pathway for the balloon catheter. First, connect the balloon catheter and the manometer. Second, exhaust the air from the balloon catheter. Then send the catheter into the Meckel's cave through the puncture needle sheath. There are 3 marks on the catheter to provide reference for monitoring the depth of balloon penetration. At the both ends of the balloon, there are 2 built-in metal rings designed for precise position during surgery. Inject contrast medium into the balloon until it forms an ideal shape. Turn off the manometer for maintaining the pressure at the targeted value. When the preset compression time is reached, turn on the manometer to release compression. Withdraw the balloon catheter completely into the puncture needle sheath. Pull back the whole system together. The operation is finished. Matrenue PBC Kit is specially designed for PBC surgery, and its key advantages are complete configuration, high efficacy, and perfect controllability.